Hi there, Glocal citizens. Welcome back to the podcast that inspires a borderless mindset around manifesting a new world. I am your host, Florence Adu, coming to you from Accra. Yes, I am back in Ghana. I am in it with the people because we are in a time of very interesting, dare I say, state of emergency, because I was just listening to the radio and we have this thing called Galamsey. I don't know if you've ever heard of it, but apparently there's this issue across the world in places where mining and extractive works go on. And ours is called Galamsey, and that is illegal small-scale mining. And so many pictures have been on the internet around the aerial view of the landscape in regions of Ghana. And it's heartbreaking because all of the water bodies are brown. So just think about the idea of not having water. And this has been something that's been brewing for many, many, many years. And it's really starting to confront us. We have protests, and the question is, what actually is our government really going to do about it? It's an election year, and it's startling how leadership is at such a deficit and power is in such a corrupt form. And so it's enlightening to be able to have a different kind of conversation on this podcast with people who are doing things to move the dial to really improve lives. And this conversation is the next in our series of conversations around the Women of Africa post-pandemic empowerment and advocacy program that is being produced and promoted by the Live Well initiative. So today we have the woman who is behind that program to give us some light today. She's been on the podcast before. It's been many years. The last time she was on was during the pandemic. This is a great revisit of what's been happening in her life in that time. And so I'll get to her bio, just a brief update. And of course, go back to the episodes. I think in the last few weeks, we've been profiling different participants. And in each of them, there's a link to her shows and her programs. So go to the show notes. Again, they're always rich. Check them out. Here's her bio. She is an international award-winning scientist, social entrepreneur, health systems researcher, adjunct lecturer, consultant, clinical pharmacist, and public health manager. She is the first vice chairman and CEO of Live Well Initiative, LWI, a self-sustaining nonprofit healthcare social enterprise, which has impacted over 2 million Nigerians and thousands of Ghanaians with health literacy, improved overall health, and wellness. And as I said, she is the brain behind the Women's Post-Pandemic Empowerment Program of Africa, which is a Gilead-Sciences Inc. supported regional program empowering all women of Africa. And the program has visited 10 nations with the goal of empowering all women of Africa with post-pandemic era kits to help them with mental health and accustom them in the principles of resilience. Dr. Bisi Bright, welcome back to the podcast.
Thank you, Florence. It is indeed a privilege and pleasure to be here with you today. Thank you.
Thank you. It's so good to see you. This is exactly the purpose of the podcast, to help local citizens to elevate their platforms to a broader audience. I was so happy when she reached out and said, look, we're doing this thing. Can you help us out with telling the story? And I'm so happy that I've been able to do that and profile the panelists that have been a part of the program from the beginning and who are in it to the end. And so we're going to start in our regular format, which is just a recap of where are you from? Where are you local? And what is your craft now and in this post-pandemic era?
Yes, thank you again, Florence. Like I said earlier, it is indeed a privilege and pleasure to be on this program. And I'll quickly introduce myself. I am from Nigeria, the western part of Nigeria. In Nigeria, we have 6 geopolitical zones. I'm from the southwest, and I'm Yoruba. We have 3 major tribes. I'm from the Yoruba tribe. And I'll quickly also talk about the Live Well initiative, which is a wellness organization. We actually run wellness programs within the corporate world, and then we work with low-income populations and the people at the base of the pyramid, where we run a lot of free health programs for them. And we, by barter, we work with government and the corporate world to make sure we get enough funding to fund the healthcare programs at the base of the pyramid. And that is what has led to the post-pandemic women's empowerment program in Africa, which is taking us to 10 countries in Africa. And we have covered quite a few programs already. We've been to Mauritius. We've not yet been to Ghana. We hope to get to Ghana. Yes. And we are trying to empower the women, like you talked about, the mental health, which is a very negative fallout of the pandemic, and then resilience. You see that when you interview Dr. Tolani, she talked about the model in Zambia, where the women have a cooperative, which is one of their resilience programs for the post-pandemic period. So the program is really out to empower women, because women are very powerful in the family. If you empower a woman, you empower a nation. And the women play a key role in the health of the family. And so that's why we're running this program. And we are being supported by Gilead-Sciences, although we do have other partners in the different countries to which we've been or are still going to. Thank you.
And so, thinking about who you were during the pandemic and what kind of works you were doing then, how has your craft changed? Has it changed? What is it that you are increasingly passionate about or putting more of your efforts into?
Yes, the pandemic came with its own challenges. I have mentioned mental health, but I did not mention the domestic violence. That was one of the key things that came out that was negative, very negative with the pandemic. And so we also formed a subsidiary called the Mothers Against Domestic Violence, because we noticed the heightened domestic violence during the pandemic. And even the Women's Post-Pandemic Resilience Program also talks about the violence, domestic violence, and so on. But the two key things that we are promoting are food resilience, because, with the pandemic came a lot of economic constraints. The lockdown led to a drop in income in most homes and families. And so we have the food resilience program, which is a bit similar to what Madam Esinai Zambia described when she talked about the cooperative that they have among the women. So we noticed that we've had to put in food resilience programs and also teach the women about food resilience. Another thing we've had to work on is the health outcomes, especially for children and infants. We had to, for example, lock down our health posts in the low-income area during the lockdown. And even post-lockdown, we had to reopen with abbreviated services due to increased cost of running the services, of course, increased demand, yet we had less funding and all that. So that was a major challenge. And during the time that we did lockdown, the government invited us to open up quickly, because they also noticed the gap in the immunizations, vaccines, because we do partner with government. We are endorsed by government. And so when we were not working, they were not very happy. But because we are not government funded, we couldn't really get enough funding to keep the services running. That was an outcome, a negative fallout of the pandemic. And I'm sure you know that a lot of organizations, public and private, did go under either during or after the pandemic. But we, as a civil society organization, we've been able to stand tall and wade through the storms. It hasn't been easy, but we've been able to do that. We, as an organization, have also adopted resilience as our own property and quality, and something we look up to. So you find that within the Live Well initiative, we now have food resilience, program resilience, financial resilience, and different models of resilience that have helped to sustain us and keep the programs going. And then what we have done is to keep at pace with the new developments, because there are also a lot of positive. I've talked about the negative fallouts of the pandemic. If you look at the positive fallouts, we now have a lot of the world is now just one big global village, much more realistically, so that you could run a program in 2, 3, 4 places at the same time using artificial intelligence, blockchain technology, digital technologies, the Zoom, for example, that we are using now, and all those things. They were there before the pandemic, but more so after the pandemic, they came with a new normal. And with the new normal, things are being done differently. So we are also embracing the new normal. For example, we adopted the policy of working from home, and that has helped us to save on electricity bills and other bills. Of course, our rent has not reduced, but we've saved on some of the utility bills.
Mhm.
And working from home has also enabled us to give more attention to some of the online programs that we could have run before, which we were not running optimally prior to then. For example, the health post where we offer free health services to the people, rather than shut it down completely, we reopened, but we've not been able to reopen on alternate days. And the communities have also adjusted to that. So they go there on alternate days. And if there's an emergency, they go to the government hospital where they sometimes have to pay a bit. For us, it's absolutely free for them. So those are the fallouts, both negative and positive. But on the whole, I would say the pandemic has come with its own advantages for the world. Of course, human beings are resistant to change, but change is the only constant thing in life. And for us at the Live Well Initiative, we've been able to adjust to the change. In fact, with the pandemic, we went into research. We did not have a research team before, but now we have a clinical research team. We've been able to publish open access international scientific journal articles and manuscripts since the pandemic. And so we've expanded. We've been able to start off our tertiary training institution, which is still online for now. It's called the Global Public Health University. It's online for now. We have our pro-chancellor is an emeritus professor in the University of Massachusetts. And so we found a lot of advantages in the pandemic, despite the minuses. And the way to go is just to adopt the pluses and move forward with them, and then discard those minuses and not allow them to weigh one down. And a very practical example in our hepatitis program, because we run quite a number of infectious diseases programs, with the hepatitis advocacy, we screen every pregnant woman for hepatitis, and then we link them to care if they're found positive, so that we can help to prevent mother-to-child transmission, which we call vertical transmission. And then those who test negative, we vaccinate within the population, the general population. And these days, because of digital technology, we have embraced the artificial intelligence and blockchain technology. And so we are issuing to our clients vaccine passports. So when we vaccinate them, we give them the vaccine passport, which is an intangible, invisible online passport, which is a record that they can access from anywhere in the world that shows that they've been vaccinated against hepatitis. So those are some of the new technologies and newer things that we have embraced with the pandemic season. And so it's not all a woeful story. In fact, there's quite a lot of good that has come out of this.
Nice. And I think that the name of the program says that. It's all about empowerment.
Yeah. The name actually says empowerment to show that can be trained to see the good in the pandemic and the post-pandemic period, manage it well, and get empowered, because knowledge is power. Even talking about violence, knowledge of it is power, because there are quite a lot of women that are abused and they're not even aware that they're in an abuse situation. Yes.
Right. And that they're not alone, because I think that's a lot of part of domestic violence is this feeling of isolation, shame, those things that keep you from talking and seeking support.
Yeah. And part of the empowerment is to encourage women to come out and talk about it. I'm actually a member of the International Alliance of Patients Organizations. And in that alliance, we empower patients. We actually train as experts. And the patient who is an expert is a patient who is totally destigmatized and can come out and openly talk about his or her condition and encourage other patients. So we've been able to empower women who are in a domestic violence situation to come out and talk. And we even have ambassadors among them. And we cut across all the literacy, low literacy, high literacy. So we have an ambassador, for example, who is a housemaid, a low literacy lady who works as a housemaid, but she's one of our ambassadors for domestic violence, that is against domestic violence. So when we're going out to talk to women, she would share her experience, how she underwent abuse, how she's been able to cope, how she got herself out of that situation, etc., etc. So those are some of the exemplary things we do to empower the women. So it's real empowerment. And when they see examples of other women, they truly get encouraged to adopt that empowerment as a policy of theirs.
Mm-hmm.
So we are making them champions all over the continent. And we are launching, we call it the PPWA, the Post-Pandemic Women of Africa. It is now a little movement across Africa.
Mm-hmm.
And we are empowering the women. And we've gone across to the Francophone countries where we went to Cotonou, we empowered the women there. So we have the chapter lead in Cotonou, and that was a French-speaking place, and they were so happy. And the principles are the same. Encourage the women, empower them, build up their confidence, destigmatize them. Women should not feel stigmatized because they're simply women, feeling discouraged and disadvantaged. It's a form of stigma. So those are the things teaching them. And then they are teaching them that, yes, you can be empowered. You can feed your family if you join hands together, either in form of a cooperative, or if you're able to balance the meals, make sure you put a bit of carbohydrate, a bit of protein. You don't have to buy the expensive food components once you balance it. And so those are the things we're teaching them.
So I'm glad that you started talking about the countries that you have visited. So this is where I'm kind of putting a riff on the why, the where. When you thought about the program and how you wanted to reach women, how did you determine which countries to go to? And tell us about where you've been so far and where you're going next.
Yes, for the countries, it was a bit difficult selecting. And so what we did was to sit down and map out. We wanted to be in the Anglophone, Francophone countries so that the representative. We also wanted to be in the North, West, East, and South of Africa to make it representative. And that was why we picked Mauritius. We've been to South Africa, although we didn't do much in South Africa. We had a very small program there, but we already have our ambassadors there. So we've been to South Africa, we've been to Egypt, Mauritius, and then we've also done some countries online. We did Kenya, Zambia via our big meeting rooms through high meetings. We're planning to go to Ghana, and then we will add one or two more Anglophone countries. For the Francophone, because of the formality, it takes a lot of formality to get into the Francophone countries. For this program, we've done one, but the only one we did, we got a very strong advocacy group in place there. So the advocacy group we got, we worked through the Nigeria International School. So because we went in through a very powerful group, they will help us to reach out to the Anglophone clusters. And we have already formally launched their group, but we don't want to be too harsh on them because we don't have funding to drive that cause into the other Francophone countries. One of our next steps would be to step from one Francophone to other Francophone countries through the Francophone. Like when they are going to run a program, we'll tell them to bring in, when those clusters come in, bring in an hour or two of the post-pandemic program so that you can nurture some new members without having to go there. So it's a satellite model that we are using, and we are trying to use that model to foster more contacts, more relationships, more empowerment for the women, and spread the word. So that's how far we go.
Okay, nice, nice, nice. I remember seeing your social media about the Cotonou program. And so it looked like you did bring together a great force of people to implement. And so kudos on that. And I would agree with you to an extent because I've done work in the Francophone countries and it's, yeah, the formality is a bit different. And I hadn't really put it together until you said that. But I will say that from the grassroots perspective, just as you've mentioned, the idea of making sure that you have a local partner, I think is very, very, very important when you're doing that work in Francophone countries.
Yes, thank you. Actually, I had the privilege of working with Francophone countries years ago when I was the Secretary General at the West African Postgraduate College of Pharmacists. And I saw even the curricula and so on, they had different curricula. Apart from the fact of translating the languages, we find that they are very, very detailed. So the curricula are a bit different from the Anglophone and so on. And so with the programs too, they're very detailed. If you're going to run a program, even in a local community, you will need to go through the different tiers of government to get to the lowest level of approval. You start from the top and start going down. And I was really surprised at that style of governance, but I think that helps to make sure that no junk gets to the people because it is supervised at different levels before it gets to the people. But very time consuming, very bureaucratic. So we then designed our own model to counter that by picking an institution that could help us to remodel the model. And then we also used a powerful group of women through an institution that had a diplomatic status and some kind of cross-border status because it's an international So that was also part of our strategy. In Live Well, we've never really been a donor-funded CSO. And so we've always had sustainability and innovation as our keywords. And so we know how to innovate for sustainability. So wherever we go, whatever barriers we find, we walk around those barriers without breaking the rules. We make sure we don't break the rules because our core values are transparency, accountability, and ethics. So we keep to ethical, within the ethical limits, we look at how best we can, get maximum value from whatever we have going for us. And so that's why you find us bringing out different models that would work and will still be within ethical limits. And so this satellite model we used for the post-pandemic women's program is really working so far because even when we went to South Africa, the South African trip was a limited one. We didn't really have enough time to plan. We just got a small group of women together and got them enrolled, and they would now help us to rerun the program. So that's what we did in South Africa. The Cotonou group was much bigger than the South Africa group. In Zambia, we have Madame Sinai, who is our community advocate. We did Zambia by a hybrid method where we had some people on the ground and then some in the meeting room. So it's a mixed program. And then the Lagos program, which I wanted to bring to the last because it was the biggest. That was where we launched. And it was hybrid. We had a big meeting room with so many participants. And then we also had a big physical venue, also with a lot of participants. And the participants were made up of women from all walks of life, including students. Some of the students were medical students, pharmacy, biochemistry students, etc. We also had caterers, women from all walks of life. And it was really interesting. We brought them into syndicate sessions and they all tackled the different aspects of the pandemic. Some talked about patient empowerment. Some talked about food resilience. We had syndicate sessions and so on, which is the model we're using in all the places. But in South Africa, we couldn't break them into groups. That's the only place we didn't really have a very complete program. And we found that the outcomes of the Lagos program were really very, very great and impactful. And so we have a very formidable force there. We're hoping to take this to the next level, like whatever other program we're running and we have funding, we're going to take some of these post-pandemic women of Africa and get them out there to do some more work. And empower the women. And we have found that the low-income women who have taken part in this program have become mini leaders in their communities, leading the women, telling them, oh, we can cope in this post-pandemic era. It's not so bad after all. We can eat, we can manage, we can get the food resilience going, we can get our work going, we can earn an income, our babies can be there and healthy. We teach the women that rather than abandon everything, get your child to go with you to clinic instead of abandoning the clinic and going into a complication. We teach them a lot of things. Those are little tips here and there that really end up building up their confidence and empowering them.
I love that. And it sounds like what you're doing is putting together a community health outreach curriculum. And so what you're affording organizations the opportunity to do is to use your modules or use your resource personnel to have these conversations on the ground or virtually across different groups and across the continent, basically.
Yes, thank you. That's exactly what we're trying to do. We're trying to train champions in the community, post-pandemic champions who are women, and they will be there for organizations who want to assist these communities to come in and work with them, because we've given them so many innovative ideas of how they can be creative within the community and help members of the community, food-wise, health-wise, hygiene-wise, mental health-wise, and so on. So those who are sick now know that as patients, they have rights, and it is they owe it a duty to themselves to go to the health system.
Right.
So we're making those women advocates that are strong, and they are emerging as strong women in the communities. I see that they're so highly motivated to be part of this. I wanted to quickly add, we actually have a vehicle we branded.
Speaking of vehicles, right? You can hear it in the background.
Yes. We branded the vehicle, the post-pandemic women of Africa, and everywhere we go, the women come to us and say, oh, we want the empowerment. They pick the word empowerment. Even the low literacy women, you see, they look at the vehicle and they pick the word empowerment, women empowerment. And they say, come and empower us. We want to be empowered. So I've seen that every woman in Africa wants to be empowered, including the low literacy income women.
Yeah.
So the program is really impactful. We are able to reach more women, even those that we have not fully empowered. They are already encouraged, seeing that there's an empowerment program around for women. That only encourages them, even viewing it from a distance.
Right.
So we're trying to have as much coverage as we can, and that's why we're also using a backup huge meeting room for those who want to join online. We're still going to run at least 2-3 more programs in the big meeting room prior to the end of the year.
Okay. So you started to mention the outcomes. And so you also mentioned that you're starting to do research. So how are you measuring these outcomes, and how are you able to now leverage that to get more support, to get more funding? This is a kind of a master class for those organizations that are looking to do similar types of endeavors.
Yes, thank you. When you're running a program like this, it's so important to have your monitoring and evaluation tools. And so we count that as very, very important. Now, we usually use various tools. We have the qualitative and quantitative tools. I'll start with the qualitative tools. What is the general feedback from the people? What are the people saying? And even one of our qualitative feedback tools is the mere fact that people are being sensitized. They are being drawn to the idea of women empowerment. They're coming to us and saying, come and empower us. We count that as one of our qualitative feedback tools. But quantitatively, I would start with the primary community where we've been working and running a health post. We have found that sensitizing. We ran a food resilience program in that place, and we found that after the food resilience program, more families were able to provide food without feeling that they were starving. We could measure up to 50% of the families that collected foodstuff came back to us to say, now we can manage where they won't say they are self-sufficient, but at least they are coping. They were coping. So we found we could measure up to 50% improvement in the food resilience among the women. And then another thing we used as measure is the domestic violence. We've been able to measure that. That has been a challenge, but the best method we used for that was to pick a few models in one or two of the programs we ran, and then kind of get our ambassadors to go around and measure what's happening. We found that domestic violence, there's been a bit of a drop, but not very significant, not more than 10%. Mm-hmm. But in terms of the acceptability of domestic violence, getting more communities to frown at it. Some of the ambassadors would tell us that, oh, my neighbor wanted to beat up his wife, the community resisted it, and so on. So things like that are beginning to happen. We will not take full responsibility for that improvement, and we've not been able to measure that fully. But I can tell you for sure that we have noticed a difference, an improvement in the perception of the communities towards domestic violence in such a way that the men are now being cautioned and more careful. So we take part of the responsibility for that positive outcome because we believe that our program has helped in achieving that. As for the other things, it's a bit more difficult to measure because resilience building is a long-term process. Yeah. It's not something you can measure immediately. But we have noticed that the women who have been impacted by this program, by the time we are leaving, their confidence level is high. And by the time we have left, they are communicating better on WhatsApp because we usually form WhatsApp groups with them. Mm-hmm. They're giving us more feedbacks and they are very enthusiastic and they feel a positive sense of departure from where they were before the intervention, before the program. Although the impact is not as great as it should be, I think it's because the program is still young. We started this program just early this year. Mm-hmm. Really wish that it was a program that could go on for years. And I can tell you that in 24 months, the impact all over Africa will be so great. Mm-hmm. But even we feel the impact.
Mm-hmm.
Thank you.
Yeah, I like that. So there was something that you said that you mentioned, again, thinking about measurement and implementation, blockchain. So tell us more about how, I think it was kind of in the context of the virtual or the immunization passports or vaccination. I think you said immunization passports.
Yes, the blockchain.
Mm-hmm. Yes. So explain to us a little bit more because, what people think of with blockchain is currency for the most part, but we do know that there are operational, particularly in South America and in industrial situations where there is the use of a blockchain to track logistical programs and things like that. So tell us about how you're using it in your work.
Yes, thank you. At the Live Well initiative, we believe in innovation, and so we try to keep up with the trend. So immediately we noticed that digital technology was infiltrating into healthcare, especially as the pandemic progressed. We found more infusion of digital technology into healthcare. So we said we must take a look at it. And so in the year 2021, the pandemic was tailing off. We had 4 of our officers that went to Kumasi University to learn about health technology assessment, HTA they call it. And health technology assessment teaches about how healthcare can be delivered in a more efficient way using digital technology.
Mm-hmm.
So it talks about, they didn't really learn much about artificial intelligence, but they learned a little bit about it there. Well, the basic thing about health technology assessment is that it teaches something which we call value-based healthcare. And value-based healthcare talks about how the general community will get healthcare at an optimal value. So you spend less and give them better drugs, better care, better treatments, better admissions, but less spending. So that's value-based healthcare. Now, in the teachings of health technology assessment, you learn about that. So we had 4 officers that went to Kumasi University to learn that. It was a partial scholarship, but we believe so much in training our staff. And so we paid up the remaining part of it and they went,
Mm-hmm.
By the time they came back, we were so happy because we saw that some global conferences were now hosting sessions on health technology assessment. So we were happy that we did the right thing. We were moving in the right direction. And of course, those officers came back and started to add value. For example, one of the collaborations we have right now with the University of Nebraska Medical Center, it is our mentoring collaboration. But believe it or not, one of our health technology assessment trained officers is the one leading that program now. And so you can use your health technology knowledge in many ways, in building collaborations, in keying into programs, making your programs attractive enough for a partner to want to key into it with you. So how did we move from health technology assessment into going a step further in the space of digital technology? We just felt, okay, HTA is on the one hand, AI, blockchain, those are on the other side. And like you said, we've always known about AI and blockchain to do with money and the cryptocurrencies and all that. But we then discovered that the artificial intelligence came into health in other ways.
Mm-hmm.
And we were wondering, how could that be possible? We then saw that we could do your data capture and then things about data privacy, which had always been there in healthcare, but not with so much emphasis, became more and more important. And so capturing data privacy, and the government here in Nigeria started talking of data privacy in a more strict manner and trying to mandate organizations to go into that. So we said, let's look at data privacy and other ways in which we can manage our data better. And remember, I told you during COVID, we also went into COVID-19 research and publications. And so we found that we needed to capture our data in a different way. And that's how, with more research, we found that through the data thing, we could actually go into artificial intelligence and then capture data of patients that are being vaccinated and other things through artificial intelligence and blockchain. You capture their data and put it in the global space. And it is their own data. They can access it, but it can be accessible from anywhere in the global space. And so today, vaccines, immunizations, and several other aspects of healthcare now involve. We've always had patient medication records, but now you have the artificially intelligent version of the patient's data. And
like an avatar.
Yes, they've gone very far in the vaccines area. So rather than a patient holding a card, I say, this is my vaccine card.
Mm-hmm.
Well, what we do is we still give them the vaccine card. So they have their vaccination card. But everything that is on that card is duplicated by AI and blockchain is infused into an intangible copy in the web space, in the cyberspace, cyber secure. So it is coded and it is secure. So nobody else will access my records. But by the time I give my name, maybe I'm going through an airport, you will be able to capture my vaccination data as part of the AI data under the data privacy. Of course, it's not that it to be exposed to everybody. In the US, they have the HIPAA Act, and the HIPAA will also have the data privacy part where those who have been vaccinated, all their data would show. Yes, we are already doing that For now, we've done that only with the hepatitis vaccines we are giving. We try to keep ourselves up to trend in everything we're doing, even though we're a civil society organization.
It's important on that level because that is the grassroots that get people's mindsets into doing this kind of, or just being part of a system that will help them function more.
Yes. And when you're a CSO and you find yourself competing in the corporate world, you need to keep yourself up to pace and try to follow the trends. And we actually ran that program for a big merchant banking group. I don't want to mention their name. And so impressed, they gave us a very beautiful letter of recommendation. They were really impressed and surprised.
So what it sounds like, if I understand, and just to kind of allay the idea of what the potential privacy issues are, I understand it now because the blockchain is a token and that token has its own secure location. And so when you're accessing that data, it is pulling only the data that's relevant to what it is that they actually need. And so that is why it is an effective tool for that assists in securing privacy, but then also letting everyone know that, okay, I passed this gate. So interesting.
It will not be in a general pool. It is coded and you can only pull out that person's
specific to what it is that they're looking to access. Yeah. Oh, science.
It's a very interesting one.
Yeah, indeed.
Science has gone really far.
Yeah.
It's really, although like I talked about the pandemic too, sometimes there are disadvantages in some of those things. Like you're typing a message on your phone and your AI is already preempting you, making the wrong words ahead of you. So sometimes the science gets too scientific.
Right. Or
advantages and the health system can adopt some of those good things for the better.
Yeah. Absolutely. So speaking of, we're talking about changing mindsets and, I always have my mindset hack question. And so I want to ask you something different. How would you like to see people hack their mindset in the sense of wellness? If you were to give a mindset hack or just kind of imagine one for the people that you're working with, what would you envision for that?
It is something that I not only envision, I preach it already. So I want everybody to have a mindset that is already hacked in a different way. I want everybody the mindset that says, oh, I have the best health in the world. Oh, healthy forever. Oh, I can be disease-free. Everybody should have such a hacked mindset. I know it's not really totally achievable, but if one has that kind of a mindset and you work towards it, I tell you, you will enjoy good health. So that is the mindset we try to teach to people. And we go a step further by saying, not only can you be healthy, you can start to reverse the disease process and the aging process. And these things are really possible. In fact, one of our physicians ran during the COVID pandemic. We are over 1,000 volunteers in the Live Well initiative, and we are all over the world. So one of the physicians ran we call it aging reversal program. That is reverse chronography. It's not a specific thing that we pulled out from anywhere, but we pulled it together and we had this workshop and trained about 20 people during the pandemic. In fact, I'm going to encourage him that we should pull it up again. We did that as a pilot, but I think we need to pull it up, revise it, polish it, and bring it out there because really I believe it's working. So the hacked mindset should be the mindset that says, yes, I can be healthy forever. Yes, I can be disease-free. I can even reverse those diseases that are there already. And I can then reverse my age because it is worn out tissues and cells that lead to aging and so on. It could be controversial, but I believe it is something substantive that can be proven scientifically. And we have the institutes like the Institute of Aging in the US, for example. And then within the Live Well initiative, we have nutritionists in-house that would argue with you and tell you that, yes, you can reverse disease and aging with nutrition. So those are the LWI hackers.
Okay, I like it. I think that's a wonderful hack. I mean, it's true. So many studies have proven that if you see yourself in a certain way, that is how you will be. So when you first said, I am healthy, that's it. If every day you're saying I'm healthy, then that is seeing yourself in that way. It's a huge hack.
We have what we call the self-care toolkit. We don't encourage people to care for themselves on their own without the help of a qualified healthcare professional. But the self-care kit encourages even people that suffer from chronic disease to learn to take responsibility and manage their condition in partnership with their healthcare professionals. So you find a lot of people, they're careless. Maybe they're hypertensive or diabetic, and they just sit down there, go for appointments in the clinic and come back home, possibly don't even take their medicines, or they take it when they remember. That's carelessness. But if that person takes responsibility, knows his or her numbers, knows the number of hours to sleep for in a day, the number of calories or whatever is best for them to eat. So they also take responsibility. So we call it a self-care toolkit where each person knows their numbers. And my numbers may be different from your numbers because my medical history may be different from your medical history. And we can both enjoy very good health. Because factors to our health.
Nice. So we've been talking so much about health and wellness. And so I want to know, and my audience wants to know, who are you nowadays when you're not working and thinking of wellness? What are some of your leisure activities? Are you reading? What are you reading? What are you watching? What are you listening to? Give us a little bit of who Bisi is when she's not championing health.
Thank you. When I'm not championing health, I am different persons. So I'll tell you about the very different personalities that I am. I'll talk about family. I'm a family lover. I always like to describe myself as a woman, wife, mother, and I'm also a grandmother. So I love those aspects of my life, possibly even more than I love work. But the way I work, people say I'm a workaholic. I don't really know, but I love these aspects of my life even more than work. So I love to be at home. I love to cook. I love to bake. I love to play in the garden. I sometimes even love to feel like a child. I'm like sitting in the swing out there in the garden and playing like a child. But unfortunately, I don't have a swing in my garden, so I can't do that. And I made sure I didn't put the swing so the neighbors won't say, oh, is that one grown up? But just to show you that I'm a happy-go-lucky person.
Sure.
I like to be happy all the time. I like to make people around me happy. I also gardening, and I love to play with children, and I love to cook and bake.
What are your go-to dishes for baking and for
my go-to dishes? You won't believe it. Maybe it's because of the way my mom brought me up. My mother was very strict, and so she made sure I learned to cook everything, to cook, bake, and everything. She made sure I could mop the floor. She just made sure that I was all domesticated all around. Because of that, I found myself being good at cooking both African food as well as continental food and in baking too. But I would say my key favorites are the jollof rice, which is the Nigerian. Everybody, I'm sure you're not surprised I mentioned that.
No, not at all.
But when you cook the jollof rice, people will tell you that if your jollof rice glues together, then you don't know how to cook it. So I can cook jollof rice that does not glue together. The grains of rice stand apart from each other. So people say, take your jollof rice. I cook jollof rice very well. But fried rice is not a Nigerian food at all, but I do that very well too. And then have the very fast ones that I can cook in 10 minutes. I don't know what they call it's this draw soup. I'm sorry, I've forgotten the English name.
No, tell us what the name is.
They call it, the African name, they call it ogbolo.
Ugolo. Okay. I know it. I don't even know if there's I've only heard ugolo. I've never.
So that's, I can cook that in 5 to 7 minutes and the meal is ready, and you take it with the cassava flour, which is gari. So if I want to do a very quick, fast meal, I do that. So I have my kitchen tricks where I can prepare a meal in 10 minutes and the meal is ready. And then I have the longer ones. Then for baking, my favorite bakes are, I love to make a meat roll. That's very easy for me. Yes, just get the meat, boil the eggs, and then stuff them in, roll the meat, put these boiled eggs, and then put it in the oven and bake it. And it looks like a loaf of bread where you cut in slices and you have nice slices of meat with the boiled egg.
High protein.
Yes, that's one of my favorite bakes. And then I love to bake a very rich fruit cake. I love that. I know that my friends love my cakes, but my son beats me to the chocolate cake. He's so good. He can do it in a very short time, make it fluffy, rich. And, you know, I do chocolate cakes too, but I'm not as good as my son with that. But for fruit, that's one of my specialties. I'm very good at baking rich fruit cakes. And I also like to make, for a very fast, quick breakfast, you know, the French toast, they call it. You know, you don't, I do it in two different ways. I either mix the egg and then soak the slice of bread in it and fry it. So you fry it. Or sometimes I put a slice of bread, cut a circle in it, break the egg in it in the pan and fry. So two styles that I used from my own French toast. I don't know which one the real French people call their French. That's my kitchen, and I do a lot of experiments all the time. I also like to bake jam tarts, rock buns, scones, sausage rolls. I love to bake. I love to bake. I love to bake. I love to do all those things.
All right. Sounds like you have a full-on active, non-working life. I love it. It's great.
I myself very active, and that's part of my hacking too.
Yes.
To hack life.
Indeed. Bisi, this has been so wonderful. I really appreciate your time spending with us. And I look forward to, I think we have one more in the series of conversations about the post-pandemic Women's Empowerment Program. And I just feel like this information will live long for others to come upon it. Just as you kind of said, you know, we just need to spread a wide net and get people informed. And so before we go for today, do you have any last thoughts that you'd like to share with the audience?
Yes, thank you. I want to thank everyone for listening to us. And I hope that people out there would remember that in this one global world in which we are, we do matter to each other and we do need each other. And so each of us should make it our duty to care for one another and care for our neighbors and care for being in a place of integrity at all times, doing the right thing at the right time. Because even something as simple as not taking your medication responsibly can cause a problem for the next person, because you can develop resistance if it is an antibiotic. And that antibiotic resistance can affect the next person, even in another country. So we should care about each other, and we should care about doing the right things at all times, even when we don't know whether it will affect another person's health or not. Thank you.
Thank you for that. Thank you so much. All right. So if you can just tell us, when are the next activations for the program? And we'll put that in the show notes.
Yes, we're having the next program, I think, in late October. We're thinking of going to Ghana, but I need to confirm that to you.
So we'll just keep a live link to the website to know more. And
yes, we will definitely let you know. But we are going to have, like I told you, 3 more big webinars, which we will definitely.
Okay, wonderful. All right, Glocal citizens, this has been another episode of the podcast. You can catch us Tuesdays with new episodes at glocalcitizenspod.com or wherever you get your podcasts. Please like, share, subscribe, leave us a review. You can leave up to a 5-star review on Apple Podcasts or Spotify, and thumbs up on YouTube. We are still looking for 100 in 2024. So just, keep positive, keep well. And until next time, bye for now.